Colleagues and friends, welcome to our special debrief session for health professional. Interpretation is available in English and Spanish, and feel free to choose your preferred language from the button below at the toolbar. We organized this session because we firmly believe in the critical role health professionals play in driving climate action, shaping policies of our planet. Today's events begin with a focused presentation from the Lancet Countdown colleagues, followed by a high-level panel discussion with the global leaders on the urgent need for sustainable, resilient health systems and the powerful influence health professionals can bring as some of the most trusted voices in society. I urge you not to hesitate and fire away your questions for our speakers using the Q&A box at any time during this session. Without further ado, it is my pleasure to introduce our first speaker, Maria Walawender, Climate Change and Health Research Fellow at the Lancet Countdown on Health and Climate Change. Maria, the floor is yours.
Thank you so much, Lou Jane, and thank you so much to the Healthcare Without Harm team for having me today. I've just shared my slides, and Lou Jane, if you can just give me a thumbs up or a nod to let me know if it's showing.
Yes, I can see your slides.
Perfect. Okay. Well, then I'll jump right in. As mentioned, I work at the Lancet Countdown on Health and Climate Change, and today I'll be talking about our most recent report, which came out just a few weeks ago at the end of October. As a brief introduction to the Lancet Countdown, I'll mention that we began producing indicator reports back in 2016, which is also the year that the Paris Agreement entered into force. We were established as a monitoring system to track progress made on reaching Paris Agreement goals, mainly keeping heating well below 2 degrees Celsius, but ideally below 1.5 degrees Celsius. So this year's report marks 9 years, our 9th indicator report, and while we've often monitored progress, we've also really ended up monitoring the growing impacts of climate change on health in the lack of progress. So over the last 9 years, we've aimed to track the relationships between climate change and health quite holistically. As healthcare professionals know better than anyone, it's what happens inside and outside of the healthcare setting that really defines well-being and health overall. We now have over 55 indicators across a variety of disciplines, and this simple graphic just outlines our approach. In the center, you can see the purple area showing the health impacts of climate change. These are the things we might think of most easily, whether it's heat exposure or infectious diseases. And then below this, we have two blue circles representing our two most common ways of responding to these health impacts. On the left, we have health adaptation, representing how we respond, how we increase our resilience and preparedness and adapt our systems in order to be ready for these impacts of climate change. And on the right, we have the health benefits of mitigation. Mitigation is really focused on driving down the harmful emissions that are causing climate change. And we also note the many health benefits that come with these actions. Crucially, surrounding all of this in red is the economic and political context. It's a crucial component as any action or decision-making is really rooted in finance and in political will. Of course, working across so many disciplines and areas requires an interdisciplinary team. Our 2025 report included input from 128 experts all around the world from these 71 different institutions. This includes medical doctors, nurses, epidemiologists, engineers, experts in social science, energy, agriculture, etc. And together, me and 127 of my colleagues have prepared our most recent report, which is the most comprehensive assessment of the relationships between climate change and health that we've ever had. I'd now like to walk you through some of these key findings. I've broken this down into a few key messages. And the first is that our delays in taking action to address climate change are increasingly leading to needless suffering. It's costing lives, it's impacting livelihoods. And we see that our continued dependence on fossil fuels, our continued emissions, and our inadequate adaptation efforts are fueling global warming and impacting millions of lives each year. Some of the most ubiquitous impacts result from heat. I imagine most, if not all, folks on the call have experienced some type of heat wave over the last few years. We saw that since 2020, the average person somewhere on the globe experienced about 19 days of heat that threatens their health. We've been able to calculate that about 84% of those days were specifically because of climate change, meaning 16 out of 19 days would not have occurred were it not for human-induced warming. Of course, there are huge differences across different regions of the world. And there's concern both in those areas where people are chronically exposed to dangerous heat and in areas where people are not acclimated to regular heat exposure and may not have adequate adaptation measures in place to keep themselves safe. Of course, heat exposure impacts range. It can be discomfort, it can be heat stroke, but on the most extreme end, heat can lead to death. Pardon me. Completing the most comprehensive assessment of heat-related mortality that's ever been done, we know that there's now over 500,000 deaths every year due to heat. To think about this another way, that's 1 death per minute throughout the year just due to heat exposure. And while certain groups, including the elderly or the very young, or those with certain underlying conditions, are at the greatest risk of extreme outcomes like death, really all people are vulnerable to some degree. In addition to changing temperatures, climate change is also impacting precipitation patterns. Taken together, these changes in both temperature and precipitation are affecting the suitability for the spread of infectious diseases, including many vector-borne diseases, vectors being things like mosquitoes or ticks. Many of these vectors have certain conditions that must be met in order for a given parasite or infection to spread effectively in people. This is impacting diseases like malaria, West Nile virus, and dengue. In just the first few months of 2024, there were about 7.5 million cases of dengue reported to the World Health Organization, which is a huge increase from the previous year. The suitability for the spread of this disease is increasing. And while the exact link between suitability and incidence is still being studied, an increase in transmission potential raises the risk of outbreak or epidemic. If we shift gears a little bit, we can also look at the health harms that come. Oh, sorry. Can you still see? Yes. Okay, sorry, computer just gave me a weird message. So shifting gears, if we look at the health harms that come with the type of actions that are fueling climate change, we can look to where we get our energy sources. We know that consistent reliance on fossil fuels is one of the driving factors of human-induced climate change. And in addition to that long-term heating, the burning of dirty fuels makes the air that we breathe unsafe. In 2022 alone, the burning of fossil fuels like coal or gas resulted in 2.5 million deaths from associated air pollution. These are deaths that could have been avoided simply without the burning of that fuel. Additionally, millions of people around the world still rely on dirty fuels to burn in their home for cooking or for energy. This includes fossil fuels and biomass, which includes things like dung or wood. And we saw that looking at just a sample of 65 countries, there were over 2 million deaths from air pollution in homes in 2022. And transitioning away from burning dirty fuels in the home presents an opportunity to improve indoor air quality and very acutely to save lives. While I don't have the time to go through every finding from every indicator in this year's report, I'd like to show you this graphic for just a moment. I don't anticipate you can read every line, that's not the important part. But what you can see here is a general shift in color gradient. This graphic is showing indicators related to health risks and impacts, with darker blue colors representing less extreme risks to health, and darker red colors representing higher risks to health. You can see across the board, most indicators are shifting towards a darker red. And those with a white dot in the most furthest right column represent record-breaking risks to health in most recent years of data. In fact, 13 out of the 20 indicators that we have record-breaking risks to health, with many others shifting in the wrong direction, even if not hitting records. Despite this quite dramatic risk to health that is visibly increasing, we're not seeing the wide-scale and urgent action that we need to protect lives. In fact, many governments and companies are moving in the wrong direction. And the second key message here is that the reversal of climate commitments threatens to put health further and further at risk. And meanwhile, adaptation is becoming increasingly challenging with every fraction of a degree of warming. To truly grapple with the size of the crisis, we have to look at the areas most responsible for emissions. The energy sector is the largest single contributor to greenhouse gas emissions. And about 80% of the world's energy still comes from fossil fuels, including coal. You can see here a little dip showing us what's possible when the world comes together and drives down its emissions. That dip was the COVID-19 pandemic. And as you can see, following the pandemic, energy-related emissions have shot back up and hit an all-time high in 2023. In an effort to transition to clean renewables, we've seen the share of our electricity that comes from sources like solar and wind skyrocket in recent years, but that renewables only account for about 12% of our global electricity, and there's huge disparities between countries. Here, the Human Development, or HDI, is used, and the Human Development Index translates roughly to other designations you might have heard, like developed and developing countries, high income versus lower middle income countries. And what we see is that very high HDI countries, aka the richest countries, have the highest percentage of renewables compared to low HDI countries, or the poorest countries, which have the lowest rates, despite often being those with very rich renewable resources at hand. It's technology transfer largely that prevents the full utilization of these clean energy sources and presents a real global equity issue in the continuation of energy poverty. On top of this, we see that governments are continuing to subsidize the use of fossil fuels to the tune of billions or trillions of dollars. And our dependence on these fuels is making it harder to transition to clean renewables at a large scale. What we do is compare any type of fossil fuel subsidy at the national level to any type of carbon pricing mechanism that brings in revenue from putting a price on emitting carbon to get a net carbon price. We see that most countries that we analyze have far greater fossil fuel subsidies than they have any type of carbon revenue. And this may not sound like it, but this is absolutely a health issue. In 2023 alone, 87 countries that we tracked allocated almost $1 trillion in net fossil fuel subsidies. And for 15 of these countries, they gave more in net subsidies than they dedicated to their entire health budget that year. While a transition away from fossil fuels must be thoughtful and not negatively impact the poorest among us, the scale of these subsidies hints at national priorities, and these billions of dollars could perhaps be better spent on actions that support health rather than hurt it. These two slides are just a glimpse of the scale of the problem. And while records continue to be broken, we urgently need a response large enough to match the size of the problem. However, we're really starting to see the opposite. As I mentioned earlier, many countries are reducing their ambitions and commitments. And just one outward sign of this is the dramatic drop in discussion of health and climate change at the United Nations. One might argue that this decreasing ambition from national governments is taking some pressure off of companies. Regardless of the true motives, we track action. And what we see is that 100 large oil and gas companies in the world are increasing their production. Each year for the last 4 years, the strategies of these 100 companies have increased their share of greenhouse gas emissions. And as of March of this year, their emissions would be nearly 3 times the level of emissions that would keep us within that 1.5 degree target of the Paris Agreement. This is a pretty daunting picture, one could say. We're looking at backsliding and contending with folks pushing us in the wrong direction. However, climate change action offers a lifeline to millions around the world. In some ways, we're lucky because climate change solutions, they're not a secret. While there's still much to learn, we know enough. We know more than enough to act urgently, and to act boldly. And in places where this action is already happening, we're already reaping the benefits. In some areas, there's been a decrease in the use of fossil fuels, largely decrease in rich countries in the use of coal. In these places, the air is getting cleaner. And the reduction in coal use, the cleaner air, has prevented about 160,000 deaths per year just from that transition away from a dirty fuel. As mentioned earlier, this is an immediate benefit to air quality, to quality of life, and it's a life-saving measure. All that on top of a long-term benefit of driving down emissions and therefore preventing additional disease in the future. And while some governments might be taking steps back, we're seeing actors at other levels step up. Cities, for example, are taking the lead. It's projected that about 70% of the world's population will live in a city by 2050. And cities are recognizing this and recognizing the threat that climate change poses in general and specifically to health. And it's very heartening to see that 97% of cities are taking the step to understand the risks and vulnerabilities of their communities and to plan accordingly. Of course, we're also seeing other sectors step up. Crucial among them is the health sector. It's one of the reasons I'm so excited to be with all of you today. The health sector accounts for between about 4.5% to 5% of global greenhouse gas emissions. And so our healthcare providers not only have a role to play in treating patients affected by climate change, but they're also taking active steps to protect the lives of their patients and to create long-term emissions reduction action to protect patients both now and into the future. The health sector globally has stepped up to this responsibility and driven down its emissions by 16% in a single year. It's incredible leadership from healthcare professionals, and I know my colleague will speak to this a little bit more specifically in a moment, but the healthcare sector is one of the most trusted and powerful sectors in the world, and it is really leading the way on what we can do away from national guidelines, away from the ambitions that are being set or backslid elsewhere. Health professionals are taking the lead. Before I close, I'll leave you with one idea, which is that yes, we're seeing record-breaking threats to health. and it can seem quite daunting. But the rewards of climate action are not measured in degrees, not measured in emissions, but really measured in lives and well-being. And we know what we need to do. It's really time for all hands on deck. And I know that it's many of the people on this call who are really leading the way. And I'm excited for the discussion to come and the leadership that will continue from the healthcare space. So with that, I'll say thank you again so much for having me and for the opportunity to share some of our findings from the report today. And I'll hand it back to Lujane for the rest of the agenda.
Thank you so much, Maria, for that insightful presentation and for presenting in detail several important indicators at the report itself. There are already some couple of questions already started flowing by our participants. Now, before we move to the panel discussion, we are pleased to share a video message from Professor Nick Watts, Director of the Center for Sustainable Medicine at the National University of Singapore's Yong Lu Lin School of Medicine. In this contribution, Professor Watts will highlight some key findings related to climate-resilient healthcare systems. Unfortunately, he couldn't be able to join us today, but he sent us a video message. Let's hear from Nick.
Hi friends, thank you for having me. I'm sorry I couldn't be here live. The benefit of that is I had the time properly to sit down and remind myself of the 2025 report of the Lancet Countdown, and also to go and look seriously at the panel. The main thing I learnt from both of those things is, number one, God, so much has changed since I was involved in the countdown in a deeper way. Also, so much of the world is the same, hey? The second thing I learned is you guys have a pretty great panel here, and so I think you need as short a time as possible from me so we can get some more time for questions. But can I put a plea in? Can people please think of some grumpy questions, some hard questions, no questions that are everything's so great, the health profession is trying so hard, how do we try harder? Let's ask something a little more pointed, hey? Maria will have already spoken about the main findings in the countdown, and there's maybe to back up what I said before, that so much of the world is the same. 628% of people faced with health-threatening heatwave days compared to a world without climate change, costing over $1 trillion, almost 1% of global GDP in lost labor capacity, 299% increase in land area experiencing extremes of drought compared to a decade through the 50s, a 48% increase in the suitability of Aedes aegypti, or 18% for albopictus. What is the same is that those numbers are scary. What is different is that, God, they're more scary than they were before. But what's changed? What has changed, honestly, I think, is that the world's healthcare systems have woken up. And these things, we often put down health systems. We often say, oh, we want to go and focus on public health. We want to focus on the broader determinants. And we should. We absolutely should. But we should also remember that these health systems are enormous, ungodly things. They have budgets in the billions, the hundreds of billions. They are often in any city, town. They are by far the largest employer. They are by far the sort of largest economic weight. In the UK, we often referred to the NHS and its role in each of the different towns scattered across the country as anchor institutions. It was the part of government of last resort that was always going to be there. Since 2020, I think, through to where we are now 5 years later, there has been a huge increase in engagement. And that shows up in the countdown statistics. It's kind of cool when you see that spike and then you see the data reflected. We see 58% of WHO member states completing a vulnerability and adaptation assessment, 60.1%, 60% completing an HNAP, a health national adaptation plan. 83% of meteorological officers providing climate services to the health sector, getting that vital information and putting it into the hands of clinicians. Those numbers may not be 100%, but they were not easy to come by. They were victories that were hard fought to engage those healthcare systems from across the world, to provide some of that expertise, to build up that capacity and to sustain it as well. There's real positivity there. The Belém Health Action Plan, just published by the Brazil Health Ministry and the World Health Organization a couple of seconds ago in Brazil, it laid out a set of pretty clear interventions that countries could take. It also saw $300 million come online to support engagement, implementation, and scaling up. Is it enough? No, it's not enough. We estimate about $22 billion per year required by 2035 for health sector adaptation. But 300 million is 300 million better than where we were yesterday. And honestly, if you went back 10 years, it would be inconceivable that we could have that level of support just for health system adaptation. It's really cool. From 2021 to 2022, emissions in the total healthcare sector, they fell. They fell down to 4.2% of the global average. They fell 21 to 22 by 12%. That's positive. But we have to remember that for the most part, this is a post-COVID wind down in health expenditure. In many cases, not in all cases, it's an appropriate wind down in health expenditure. But 4.2% is still a lot, and when we look around the world, we can see in a whole bunch of countries, in Singapore where I am right now, not 4.2%, 7%. That's sizable. So to feel reassured on this one, I can't look to the Countdown 2025 indicator because, I'm happy with the 12% reduction. But where I draw that inspiration from, honestly, to feel reassured is the spike in engagement that we've seen over those 5 years in health ministry engagement. Serious teams of genuine experts, not held in universities and in NGOs anymore, held completely different landscape, held now inside a health ministry, inside a government. In the United Kingdom, in Australia, in the Philippines, in Singapore, in Fiji, and Brazil, that is a completely different landscape to where this world was just a couple of seconds ago. The number of high quality assessments of the footprint of a national healthcare system that meet that WHO standard that came out just a little while ago, that's not one anymore. It used to be one, and it was one for quite a long time. We're now up at 6, 7, 8 national healthcare systems that are taking this seriously. Everywhere you look, I think there is a small army of people engaging in this. So listen, it might just be that someone put something in my coffee this morning or in my second coffee this morning. But I woke up today, I had a quick look at those stats in the countdown, and I thought, nah, to hell with it. The health profession is beginning to show up, and I'm tired of feeling a little bit depressed about the state of the world. It's tough out there, but I'm tired of it. So I'm choosing to be optimistic, and the countdown helps me do that. Thanks, guys. Have a good session.
And thank you, Nick, for your short message and for being optimistic. We have several questions asking to know more about the data and the indicators. We will shortly post the link of the Lancet Countdown Report on the chat, so you have access to the full reports, as well as the regional briefs, where there are certain data on specific regions from the report itself. I encourage you to continue to post questions in the Q&A box, and we'll try our best to answer as many as possible, either live or in the box itself. Now we will move on to our panel discussion. And if I may ask my dear colleague panelists to turn on their videos so we can start our dialogue. At first, we have Mr. Jim Campbell, Director of Health Workforce at the World Health Organization. We also have Dr. Jacqueline Cthulhu, President of the World Medical Association, and Dr. Raj Shankar Ghosh, the Honorary Fellow of the Public Health Foundation of India, and Ms. Mensheri Sangwang Scalfold, President of the International Pharmaceutical Students Association, and Dr. Doria Rodriguez, Dean of the Faculty of Nursing at the Universidad Cooperativa de Colombia, and the board member of the Alliance of Nurses for Healthy Environments. Welcome and thank you for joining us. Jim, let's start with you. From your perspective, what are the impacts of climate change on health workforce? And how can we make healthcare systems more resilient to protect and empower health workforce?
Thank you very much, Lujane. Good afternoon, good morning, good evening to all the participants. Wonderful to be on a panel with physicians, pharmacists, public health nurses from different parts, east, west of the world. Buenos dias, everybody. The opportunity here, Lujane, absolutely. I think we've just heard from Maria with that summary of the Lancet Countdown, and obviously the full publication with the ever greater detail. That really these climate attributable hazards and emergencies have reached record levels. These are no longer episodic shocks. These are now becoming predictable stresses on jurisdictions, governments, and our public health and clinical health systems. And as such, we've really got to dig a little bit deeper down into some of that impact analysis to actually understand those stresses on supply chains, on the human beings, on the physical infrastructure. We're seeing literally hospitals and health facilities disappear from some of this climate-related shock, let alone the additional workload on a workforce worldwide, which is already still exhibiting huge burdens of mental health illness, stress, anxiety from the COVID pandemic, and still having to deal with yet more of these external shocks when their physical and mental health are at risk yet and yet again. And as such, this is really, we've got to look at this much more broadly now as an actual cross-cutting determinant of health that's eroding our public health capacities around the world. And that's the sort of framing of it. From the opportunity, I think, and the fact that you've got this interprofessional engagement on this, is that we have to look at this. We have to come back to some of our basic thinking and understanding. And this is the second point here. We really need to look at this from a public health lens. This is not a global health lens per se. This is not a unique set of issues which we're looking at from a developing country perspective. This is a global public health crisis that we need to review. And that's what we're trying to be doing with the professional associations, with the unions, with the educators, the deans, the regulators, to look at how do we really expand our appreciation of the essential public health functions in every jurisdiction, and make sure that everyone in the health and care workforce, irrespective of their occupation, understands the roles and around some of the surveillance functions, around the preparedness, around the mitigation, around the response, whether that's climate-related public health impacts, whether that's infectious disease related, which comes with climate, whether that's lack of economic funding, which is impacting our health systems. But understanding these trade-offs, the world is going through a regression and a retraction in financing for public health and health. We've just seen the pandemic fund being closed, the climate adaptation funds, the resilience funds that are available, all these different instruments. But we as a health professions and communities need to come together. We don't want 10 funds to do public health or individual pieces of public health. We want stewardship to support government, to support the workforce in that. And that's what the WHO roadmap says in terms of looking at the reality here. We know, and the Lancet Countdown sends us this around the role of education. But education in itself, I really appreciate the work that deans in medical schools, nursing schools, pharmacy, public health are actually doing to introduce this to the thing. But we need to go beyond education. What we're looking at is workers that are enabled, empowered with that education to change the behavior of our health systems. And that role is a responsibility and a stewardship role of government and employers. It is, if we educate people to be climate aware, public health aware, but we put them into environments where they don't have the tools, the resources, the funding, the teams to take action, that investment in the individual knowledge, skills, and capabilities of the worker is not going to be amplified into climate resilience and health systems resilience. So we have to come with it. And that's a challenge I would go back to the Lancet Countdown with and say, let's make sure that this stewardship function of government, the role of employers, the role of the private sector is as equal to enable our workers to be effective and empowered to come further forward. And finally, Lujane, I think it's really just to say that we know the workers of the world, some of the most trusted professions in being agents to communicate with individuals, families, communities, vulnerable groups in terms of what are some of the opportunities to take mitigation actions, to be more prepared and everything else. But again, let's make sure that we cannot keep putting more responsibilities, more roles on workers without also giving them the rewards. We have to give them a decent work environment. We have to make sure that they are remunerated appropriately for their skills. And if we're asking them to do more in public health and climate resilience, what work are we taking away from them? How are we using digital tools and AI and things to take work away to make them more forward-facing for the communities they serve? Thank you very much, Lujane.
Excellent remarks, Jim. And thanks a lot for reminding us of the importance of interprofessional collaboration, the cross-cutting determinants, and not just focus on education itself, but empowering and enabling the health workforce, and the importance of a safe work environment. And this is a determinant to ensure we have a resilient healthcare system that includes health workforce. Thank you so much again, Jim. Jackie, if we can move to you, if you can just highlight a little bit, what are the impacts of climate change on healthcare systems from your perspective? And what could be the role of health professionals in such resilient healthcare systems?
So thank you very much, Lujane, and really to the Healthcare Without Harm team for inviting me, and to these able panelists that I'm with. And a lot of what I'll say, I think, has already been spoken to by Jim, by Maria in that excellent presentation of the Lancet Countdown. But going back to the impacts of climate change on the healthcare system, and it's very clear, even from listening to the others, that climate change is placing quite unprecedented strain on the healthcare system. And there are really four major areas of impact that I would look at. One being the rising patient needs and shifting disease burdens. So we are seeing increased heat-related illnesses, respiratory problems, and infectious disease outbreaks. Disruptions to food security and clean water access. These are the social determinants of health, leading to malnutrition and GI diseases. And of course, the mental health impacts, which Jim has just spoken to, including anxiety, depression, and what we are now calling ecological grief. So we are looking shifting disease burdens, as an outcome of this. Two, we are looking at intensifying pressure on healthcare workers. Climate disasters indeed have coincided with workforce shortages, and I don't think there's any country anywhere where you'll hear that they have enough of a health workforce. So this coming together at the same time, surges in emergencies, increasing burnout, and of course, within unsafe working conditions. 3, we have damage to infrastructure and service disruptions. So, with the recent climate change related events, the recent one being in Jamaica, extreme weather damages facilities, it interrupts supply chains, power failures jeopardize critical services and digital systems. So, even just the infrastructure in which the health workers work in is interrupted by the changes. And then finally, the escalating financial strain. So we are having rising costs, not just for, we have rising costs for preparedness, for the resilience, for the disaster response, while at the same time, on the other side, reducing funds for essential care. We are looking at the challenge of, do we have enough for essential care? And now we have to divert the funds to, preparedness and disaster responses. So what's the role then of the health professionals in resilient health systems? And many of us have already spoken to that healthcare professionals have a very unique and indispensable role rooted in ethics, in expertise, and community trust. Indeed, healthcare workers are frontline witnesses with authority. They daily experience what climate-related health impacts, making clinicians really powerful advocates. And indeed, I just remember Maria talking to, the statistics on dengue fever. And I recall, when I was a medical student, dengue fever was a subject we just talked about more in Southeast Asia. Now based in East Africa and at the coast, we are seeing a lot of dengue fever. I am treating patients with dengue fever, something I had only read about. So indeed, we are frontline witnesses and we come with authority. Two health professionals they have an ethical responsibility. The Declaration of Geneva, which obliges physicians to prioritize patient well-being, the World Medical Association ethics, which require environmentally sustainable medical practice. All these are ethical responsibilities for healthcare professionals within the process of, trying to ensure resilient health systems. Thirdly, they can be catalysts for prevention and system-wide action by educating patients and communities, by advocating for climate-positive policies, promoting sustainable healthcare practices, and driving research and preparedness. Of course, even as I say that, I am cognizant to what Jim has just said, that yes, we are increasing the roles for the healthcare professionals, and we're compensating them for doing that. But I think some of these, as they come as ethical responsibilities, we need to be the catalysts for that. And finally, I think that the health professionals have an opportunity to improve health today. There are many of the things that we talk about, in terms of low carbon solutions, encouraging active transport, clean energy, healthier diets. All these deliver immediate health benefits. So they go hand in hand with what health professionals do, but hand in hand with also building more resilient healthcare systems. Thanks, Lujane.
Thanks a lot, Jackie. And thanks for also highlighting the ethical responsibility and the ethical duty of health professionals when it's come to first do no harm. And of course, in relation to the resilient and sustainable healthcare system from an ethical perspective. Raj, if we can move to you. Public Health Foundation of India has been doing really a superb job and tremendous efforts for resilient healthcare systems in India at the national level. If you can share a success story or a highlight with our fellow participants.
Thank you, Lujane. Greetings, everyone from India. So I represent the Public Health Foundation of India, the Center for Environmental Health. And I wanted to really take this opportunity also to thank the Healthcare Without Harm team for organizing this conversation today. It has been very enriching. and also inviting us to be a part of this. And also Healthcare Without Harm is a very strong partner for the Public Health Foundation of India in building resilient climate health facilities in India. So the example that I will give today is from a hospital of our health network. The health network is the Healthy Environment Leadership Platform Network. This is a part of the larger global green and healthy hospital network of Healthcare Without Harm, which is across the globe. We have many examples, very successful stories from very large hospitals like the Arvind Eye Care Hospital, the LV Prasad Eye Hospital. But specifically what we have chosen to speak today is about a hospital which is 100 years old from a very small town of India, which was facing difficulties in terms of the environmental sustainability and how they overcame it. This hospital is called the Lombard Missionary Hospital and is situated in a small town called Udupi in southern part of India. But before I talk about the hospital, I just wanted to talk a little bit about how we structured the health network, the Healthy Environment Leadership Platform network of hospitals across India. So we have more than 150 member hospitals who have signed to environmental and climate health resilience in terms of their activities. We measure the success in terms of how they are performing across 4 parameters, and we call them the 4 E parameters. One is about the efficiency with which they are being able to deliver the healthcare. The second is around the issue about equity, about how they are being able to serve the vulnerable population within their geographical domain. The third is about the economics part of it, the return on the investment that they have made. And finally, about the ethical healthcare that is being generated in terms of how they are being able to build trust in the community that they are serving. So with this example, I will talk about the Lombard Hospital, Christian Missionary Lombard Hospital in Udupi. So as I said, this is a 100-year-old hospital. And the major challenge that this hospital had been facing over the past many years is about having safe and quality water supply for running its daily operations and also for providing safe water to the inmates in the hospital who are being admitted in the hospital. Compounding this problem was that they were low in terms of their resources. They were not a very high profit-making hospital. They were low on their resources. And the infrastructure that they had was, as I said, about 100 years old. And they were not building the new infrastructure. They did not have the resource. So they had to identify some local solutions to the problem. So what they did was that they did 6 activities. The first activity that they did was that they rejuvenated the wells that they had in their area. They had around 8 wells in their locality, and they did the rejuvenation with the desilting and the structural reinforcement for improving the groundwater recharge. The second thing that they did was around the rainwater harvesting. Udupi is a place where there is enough rain throughout the year, and they did rainwater harvesting system across all their major buildings, the hospital, the nursing school, and the paramedical college that they have. The third is that they focused on some of the behavioral change communication through behavioral nudges to their staff and also to the community which they were serving. And these behavioral nudges included, the use of press-type taps, using smaller buckets for water storage and usage, reducing the flush toilet, to which, they could reduce almost from 6 liter to 3 liter per day the consumption of the water. The fourth thing that they did was the reusing of the treated wastewater. The wastewater that was being generated, they used it for the gardens, the vehicle washing, and for the cleaning. And finally, with the Healthcare Without Harm, they had provided a climate impact checkup tool. Through that tool, they could also do some very good monitoring of how the, flow meters and the various plant pipelines, color coding to differentiate between clean and the treated water. So these tools they used very effectively. And the Public Health Foundation of India and the Healthcare Without Harm team in India provided capacity building and training for the staff in order to use these. So what was the outcome of these interventions that they did? One was obviously there was a reduced freshwater footprint throughout their use of the water that they were reusing and the rainwater integration that they were doing. There was a reliable round-the-year water supply even during the dry months. They did not run short of water as they were doing previously. The quality of the water improved through maintenance of tanks, wells, and the filtration systems in which they made some small investments. There was 100% elimination of external water purchase. And though the saving was small, it meant a lot for them. They were saving around 1,000 USD per year by taking this elimination of external water purchase. And finally, they were, enhancing their institutional climate resilience and environmental stewardship through better capacity building, awareness generation in the community, and all of that. So the lessons that we have learned and spread to other health network hospitals has been that leadership is very, very important. They showed very strong leadership in the hospital in order to drive these changes. The second is about identifying local solutions. And the third is that low-cost investments often resulted in high impact for the local setting of the hospital that they did. So basically what we have been telling other health network hospitals is to start with simple, low-cost interventions and not wait for large funds to be invested in order to make the changes that they would like to make. The second is about integrating the infrastructure upgrades with the staff awareness to sustain the outcomes that will be generated. And the third is to track the savings so that they can make a better kind of case for the return on the investments that they have done. So documentation is a very important aspect of the work. And through the support of Healthcare Without Harm, Public Health Foundation of India is developing the compendiums of this. And these are being shared with not only hospitals in India, but also with hospitals across South Asia. In fact, last year, the Healthcare Without Harm South Asia office recognized this Lombard Missionary Hospital for their outstanding performance in terms of making local decisions in order to make some local changes with low-cost investments and fulfilling the demand that the hospital had around the supply of safe and high-quality water. Thank you.
Thank you so much, Raj, and congratulations on the great effort. You highlighted that change is possible, sometimes with low investments, high impact, and we don't have excuse to wait. If a hospital that has a very old, more than 100-year-old infrastructure that we're able to turn it to resilient, a sustainable healthcare system, which means that change is possible. Thank you so much, Raj. Manshari, we'll move on to you. From your perspective, how to better equip health professionals, particularly students, for climate change and impact? As we know, IPSF has been doing a great work in relation to advocacy for climate and health. And what is the role of youth specifically in resilient healthcare systems?
Thank you so much for the question. And just to introduce myself again, my name is Manshari. I'm the president of International Pharmaceutical Student Federation. And we have been here for 76 years now. So first of all, just to give you all a bit of a background, that IPSF do represent 600,000 pharmacy students and recent graduates worldwide. And I would like to share a bit of my story in here. So in IPSF, with a very large number of students and recent graduates, we do our work in policy and advocacy, as well as bringing actions to home, which means our federation covers 100 plus countries, and all these students and young professionals come from everywhere, from the village, from the provinces, and anywhere you could imagine within this world where they fight their way, all the way to study in prestigious faculty of pharmacy, similar to other health professionals. But at the same time, I see that climate effects do eventually come towards our way. And no matter where we are, some of us do get affected by the climate change, as well as become the climate change, I would call it, victim ourselves, having to relocate and also have to become climate refugee. But the story I'm sharing today is just from my experience as chairperson of Asia Pacific Regional Office last year, when I joined the Open-End Working Group on Science Policy panel to contribute further to the sound management of chemicals and waste and to prevent pollution, hosted by UNEP in Geneva. One of the things I realized is that the pharmaceutical industries weren't present. And that left me the question because according to the Lancet report, we also are aware that the health sector's climate footprint at around 4 to 5% of global emissions. So this is actually the same order as the total emissions from more than 50 of the poorest countries combined. So from that one particular question is that if we are not added into the conversation or the consideration of how we can manage things together, what would be the next step? Because if we are not there, then either we do not know, or either we wouldn't be able to contribute it back or find the gaps within the pharmaceutical industry. I'm using the word we because part of our federation would probably eventually ended up in pharmaceutical sectors. For example, myself, I'm working in the pharmaceutical industry myself. So this is one of the questions that I would like to leave to everyone. How do we encourage more engagement of the right sectors to be part of the conversation of climate change? And how can we work together, not just cross sections between health workers, but also those contributing to the factors of the emission? So crucially, many of the countries that contributed the least to global emissions still suffer the worst health impacts of climate change and pollution. Today, we also heard from the heat waves and also from the flood that the Lancet Countdown has been following up. One of the facts that I feel very fascinating and also frustrating to hear is that the health impact section giving an annual heat-related mortality burden of roughly 546,000 deaths per year. Imagine me not sitting here today because the whole federation is the exact same number of those who pass away. And that's just because of climate change. I feel like that's a very frustrating number to hear because you never know when one day you'll be part of those numbers yourself. So bringing this attention to you that the same number of people pass away is the same number of us representing pharmacy students and recent graduates worldwide. So coming to this, I would like to bring the information of how IPSF has been working on this climate change and also our work within the public health sectors ourselves. So because we have 600,000 members, this number grows in the contrast of the aging society where we have less fertility rate and more people coming into the system. So that's a good number. In 2020, we delivered statements at the World Health Assembly, the 72nd World Health Assembly on health, environment, and climate change. We called WHO as well as member states to strengthening air pollution monitoring, implement target policies, and protect vulnerable groups. Currently, in 2025, I would still confirm the same call and the urge we have, and still say that people are struggling to breathe physically and politically. So this needs to be addressed by everyone because we alone as students within the system getting educated cannot make most of the change. but you in the positions of change can include us, can work with us, so that one day we'll become climate ready and climate aware and come out into the system as health workers, health professionals, and also would be the voice of practitioners that could help strengthening this collaboration between all of us here presenting, so that it's not just 8 of us here, but more conversation will be made in the local level, in the village level, and also in the international level within IPSF and the others organization. So what I would like to say is that the very quick numbers that I would like to bring to you today is that if just 10% of our members avoid unnecessary single-use plastics, for instance, in our practice per day, then potentially 12 million fewer waste items per year would be reduced. If we, as a student, grow to become practitioners, or our recent graduates who have already been working, can guide 5 patients to save medicines returns, 300,000 safer disposal annually would come back to be the good number so that we can track that as well. So we will keep the pharmaceutical waste out of the water ourselves. Even if currently pharmaceutical industry is not part of the conversation somewhere, we can make it part of our agenda to do the work. And the last number that I could throw to you is that if one climate smart counseling from us to student to our members turn into the conversation on climate smart counseling with our patients or anyone we interacted with, we could see that 600,000 prevention conversation yearly on heat, floods, and pollution risk can already be there. And then you can have so much more in 10-folds to 50-folds if not all of our members are climate ready and climate change aware of these. So last but not least, I would like to propose that we should not just include us into the conversation, youth, but also include us into the decision that you would like to make, because the decision made today will affect the people of the future. And those people are us sitting here in a room, as well as all the people who will come after us that might not have been part of the conversation, but they are part of the action and also the outcome of what we made the decision today. So in that regards, I would like to just say that IPSF, as a youth-led health organizations, we work on every capacity we can in every way we can to educate, advocate, and also act in our capacity. But at the same time, the place like Lancet Countdown or Healthcare Without Harm could be part of our partnership, as you do have the resources that we would need to pass on to our members when it comes to climate change. So I hope that all IPSF activities will be progressive and transformative and also are environmentally responsible. And I hope that climate change and climate finance for resilience and adaptation in the future would also be more stable, so that more of us could be part of this and contribute to this without having to worry about whether we can find the grant or the money to really start something meaningful. So yes, that's all from my side, and I'm happy to welcome any questions that anyone may have.
Thanks a lot, Mashari. Thanks a lot. And thanks for also highlighting the importance of including pharmaceutical industry, especially in the discussion of fossil fuel phase out, and the inclusion of youth, not just in discussion, but also the decision-making level. Dorian, if we can move to you and to talk a little bit about health professional actions in relation to climate and health, specifically in the Latin America region.
Hi, thanks for having me. I'm going to talk in Spanish because there are a lot of colleagues here in this room from Latin America. Bueno, yo represento la Alianza.
So I represent the Nurses Alliance for Healthy Environments.
Nosotros en Latinoamérica tenemos en este momento participación de colegas desde Estados Unidos realmente hasta Argentina.
Of colleagues from the US to
Perdón, no
Argentina.
sé si escuchan retorno.
Can you hear? Do you?
Okay,
do we have
perfecto.
echo? No. Okay.
Nosotros en ese momento trabajamos con 4
So
grupos,
we are
estamos
currently
en
working
4
with 4
frentes.
groups
Investigación, estamos
in 4
trabajando en
fronts:
educación, en
research,
promoción y políticas,
education,
y también en buen
policy,
convivir. ¿Qué hemos hecho en
and
estos
coexistence.
5
What
años
have
desde
we
que
done in
estamos
these 5
trabajando en
years?
Latinoamérica? Invitamos a colegas
We
tanto de
invite
hospitales como de
colleagues from
universidades para que se
hospitals
vincularan
and
con nosotros
universities
y
to
empezaran
connect
a
with us
trabajar primero
and
en
start
actividades
working
educativas, porque
first
es claro
in
que nosotros, y debo
education
decirlo,
activities, because
desde la
clearly I
universidad
have to
nosotros
say,
no nos formaron
from
para poder
university we
trabajar
were
en
not
temas en la
trained
relación en
to
el nexo en
work
salud y cambio climático.
on
Así que
climate change
estamos
and
formando no
health.
solamente nuevas
So
generaciones,
we are
sino también los
teaching
de mi
and training
generación,
new generations, but
las personas
also
que
we are
anteriormente
receiving
salimos de
training
la
because
universidad y que no
people
recibimos esta
before us
información y que nos
and
estamos
myself, we
encontrando
didn't get that
una
training.
problemática del impacto del cambio
And
climático en la salud y que
now we
entendemos,
run
por
into
supuesto,
the climate
la
change and
importancia de que
its
empecemos primero que todo
intersection
a
with
formarnos.
health.
Desde el Consejo
So
Internacional de Enfermeros se han
from
hecho
the
3
Nurse
declaraciones de posición
International
invitándonos a
College, there
trabajar
have been
en
3
salud y cambio
statements
climático, en
inviting
salud
us to work
planetaria
in
y
climate
también en
change and
emergencias y
health,
desastres.
and
Entonces,
also in
en
disaster
Latinoamérica
and
organizamos
emergency
una
relief.
experiencia que se
So
llama
in Latam, we had an
intercambio
experience
académico,
called
porque debe haber
academic
interacción entre quienes
exchange,
participan de los
because this
diferentes
is an
países y en los diferentes
interaction between
idiomas.
people who
Y
participate in different
tenemos
languages
cada
and
año
countries.
un intercambio en
And
el que
every
participan
year we
todas
have an
las
exchange
universidades y
where all the
hospitales, de los cuales
universities and
tenemos
hospitals
miembros activos, y nos
of active
formamos
members
en
participate.
salud y
And
cambio
we train
climático, en el
ourselves in
impacto,
health
en
and
cuáles son las
climate
acciones de
change,
mitigación y adaptación que
preparedness,
podemos hacer
mitigation and
desde cada uno
adaptation
de los
from
escenarios donde
each
nosotros
of
laboramos.
the scenarios
Así
where
como los
we
demás
work.
profesionales de la salud, pues
Just
enfermería
like
tiene una
other
ventaja, el
professionals in
contacto con el
health,
paciente. Y en ese
nurses have
contacto
the advantage
cercano
of being
con
in
el
close
paciente en la
contact with
institución de salud,
patients
en la comunidad, eso nos
in
permite
hospitals and the
convertirnos en
community, and
promotores
that
de la salud
allows us
ambiental.
to become
Hemos tenido
promoters
una experiencia
of
bastante exitosa. En
health.
este momento
We've
tenemos
been quite
42
successful.
instituciones que han venido
We have
trabajando con
42
nosotros y
institutions
pues
working
hemos contado, por
with us,
supuesto, con el apoyo de las
and
organizaciones en
we had the
Latinoamérica.
support of
Salud
different
Sin Daño, la
organizations
Red
in
de
Latam,
Hospitales Verdes
Healthcare
y
Without
Saludables nos ha
Harm,
apoyado
the
muchísimo.
Green
También estamos
Hospitals
trabajando de la
Network.
mano con la Red de
We
Clima
are
y Salud
also
en
working
Latinoamérica y eso
with
nos ha permitido empezar a trabajar
Climate
investigación
Network in Latin
transdisciplinaria,
America,
que es absolutamente importante.
been
De
able
hecho, con mi grupo en
to
este momento tenemos un
train,
proyecto
and with
grande
my
sobre
group we
dengue y
have a
cambio
big project
climático
on
en
climate
Colombia y
change
Argentina.
in
Entonces
Colombia and
estamos
Argentina.
trabajando desde
So we
diferentes
are
frentes,
working
pero tenemos un
from
reto
different
muy
fronts,
importante
but
para
we have
nosotros
a
en
big
enfermería y para los
challenge
demás profesionales en la salud,
for
y es
nurses,
trabajar en emergencias
and
y
is
desastres
to work in
relacionados con eventos climáticos.
emergency and
Debo decirlo que
disasters
nosotros
related
no hemos
with
recibido
climate
previamente esta
events.
información, no,
We
desde las
didn't
universidades
receive
estamos nosotros
information
invitando a las
and from
asociaciones
universities we are
a que
inviting different
empiecen a formar
associations
en
to
estas
start
temáticas que son
training
absolutamente
people in
necesarias.
these
El año
topics.
pasado en Río Grande
Last
do Sul,
year
en
in Rio Grande
Brasil,
do Sul in Brazil,
ante las
there
emergencias climáticas, ante las
was a
inundaciones, uno de los
huge
hospitales
flood,
no tenía
and
cómo
one of the
actuar
hospitals
frente a la
didn't know
inundación
how
en el
to
mismo
act
hospital, cómo trabajar con
when the hospital
con los
itself
profesionales de la
flood,
salud,
how
cómo
to work
seguir
with
brindándole cuidado a estos
physicians, how
pacientes
to
cuando
keep on
tengo el
providing
hospital inundado,
services
cómo
or look after
garantizar la
patients when
seguridad
the
del paciente
infrastructure was no
cuando
longer
está el hospital
in
inundado.
service.
Entonces, tenemos que empezar a trabajar muy
So
fuerte en
we need
estas
to start
temáticas, continuar
working on this
trabajando
topic,
en salud
continue
planetaria,
working on
continuar
planetary
trabajando en
health,
justicia climática,
in
porque como lo
climate
decían
justice,
mis compañeros
because
en esta
as
sala,
my colleagues
nosotros aquí en
said
Latinoamérica
earlier,
también no
in
somos los
Latin
países que más
America,
contaminamos, pero sí
we
somos
are
los más
not the
susceptibles
biggest
a los efectos
polluters,
del
but
cambio
we
climático.
are susceptible
Así que
to
tenemos que
this and
prepararnos y
most
tenemos que
vulnerable.
seguir
So
trabajando.
we
Y
need to
aunque
be ready
nosotros
and keep
somos
on
una
working.
alianza
And despite
de
the fact that
enfermeros,
we
quiero
are a
contarles
nurses
que
alliance,
tenemos
I would like to tell
filósofos,
you
tenemos
that we have
profesionales de diferentes áreas de
philosophers,
la salud, tenemos
physicians,
abogados, y eso hace, por
lawyers,
supuesto, que nuestra
and
visión
that
sea
makes
mucho más
our
amplia, que
vision more
integremos diversas
comprehensive and
disciplinas
broad,
y que
because we
estemos
have
todos
different disciplines
trabajando de la mano con un
in our
mismo
working
propósito.
group.
Quiero resaltar que efectivamente
I would like to highlight
el área en la cual nosotros
that
debemos
the area
trabajar mucho más Esa es la
where we need to put more
capacitación y esa es
effort
la
is
invitación a
in
las
training.
universidades para que se
And
incorpore
that's
esta
why
temática en
we
la
are
formación
extending an
de quienes
invitation
hoy en día
to
se están
universities to
formando
train
como
the
profesionales,
people
valga la
who
redundancia.
are
Pero además de eso,
currently
tenemos que llevarlo hacia
on the
políticas
institutions,
públicas.
but we have to
Eso es
translate this
absolutamente
into public
indispensable y desde
policies,
las
and that's
asociaciones
crucial.
profesionales tenemos
From the
mucho por
different
hacer.
professionals
El
association,
organizarnos es
there's
un
a lot
primer
to be
paso,
done.
pero
To organize
definitivamente
ourselves is just the first step,
espacios como estos nos
but
permiten
we need
interactuar
spaces like
con
this
otras
one, so
asociaciones
we
para
can get to
poder
know other
sumar
associations, to interact with
todos
other
estos
colleagues,
esfuerzos que cada uno de
so
nosotros estamos
we
haciendo y
can
poder
join
lograr un
efforts
mayor impacto.
to
Esa es la
achieve a
experiencia que nosotros
higher
hemos tenido
impact.
en
That's
Latinoamérica,
the experience
seguiremos
we have
trabajando
had
muy
in
fuerte
Latin
desde
America. We
enfermería,
will
e
keep on
invitando
working,
a todos los colegas que se
and I
quieran
invite
unir y a todos los
all the
profesionales de
colleagues
la
to
salud que se
join
quieran
us,
unir también a trabajar con nosotros.
and
Gracias.
health professionals as well. Thank you.
Thank you so much, Dorian. To be honest, as a medical physician myself, I was taught nothing in relation to climate change or preparedness or resilience healthcare systems. So I can totally hear you, and this is kind of still an ongoing challenge. And thanks for also highlighting the importance of partnership and elevating the need of further training and the capacity building of not just nurses, but also the rest of the health professionals. We'll have a good number of questions by our participants, and I'm just adding Maria in, as some questions were following her presentation in relation to the Lancet Countdown. I will just throw the first question to all of you and see who would like to answer it. So the first question is, how should one embed climate adaptation measures within universal health coverage frameworks to really ensure equitable access to primary healthcare services for climate vulnerable populations? Jim.
Thanks, Lujane. Yeah, that's a great question, and I think that's coming from Taslima. I think we've got a little bit of work to do as a population public health community, Lujane. Universal health coverage for more than a decade has been a fantastic rallying platform framework for us to come behind health equity, universalism, the sustainable development goals. But I think we may have in that period slightly de-emphasized the public health component here. Universalism in terms of access to services has tended to be more and more tied up with those clinical services, the infectious disease, the non-communicable diseases, etc., populated sexual and reproductive health. And there's a little bit of work for us to do to embed public health functions into the universal health coverage framework. Universal Health Coverage Day on the 12th of December this week to get that thing. But if we want to do climate resilience, if we want to do pandemic preparedness, if we wish to do non-communicable disease in a coherent manner across occupations, across professions, across schools, then we need to have a bit more of the emphasis on public health and all those public health capabilities and competencies within our clinical occupations and within our professional occupations. And I think there's an opportunity, let's not lose that. Lancet Countdown and others are giving us this framework. The national adaptation plans as well. Let's bring back a population health and public health perspective to some of our global health discussions. Thank you.
Yeah, thanks a lot, Jim. That's indeed is a very important aspect to ensure that's within the universal health coverage framework. Another question could also have followed up from after Maria's presentation. If any of you know any leading cities that implementing interventions in relation to climate change and health. Perhaps, Raj, you can share some of the cities in India?
Yes, I just raised my hand. Yes, so we have many cities. One of the examples is the capital of the Gujarat state, Gandhinagar. In Ahmedabad and Gandhinagar, there are multiple steps that have been taken, and the Public Health Foundation of India, the Indian Institute of Public Health in Gandhinagar has partnered with the government to do that. Based on that model, currently there are 25 cities that the government, state governments have taken very good actions. We can share all of those with the participants when you share the recordings and everything about the actions that have been taken.
That would be great, Raj. I think the participant will find that very useful.
Absolutely.
And the last question that we can take today is, was a bit of reaction on the slide that Maria said about the influence of fossil fuels and how it affects in terms, particularly the EPA decisions. How can we combat that with their policy influence, as we see in many levels, global and national one as well? Yes, Dorian.
Gracias. Es una pregunta difícil. Es una pregunta difícil porque efectivamente
Yeah, it's a difficult question to address because
de todas las organizaciones, de todos los países, porque yo lo decía
it's of
anteriormente,
interest of all organizations and countries, because, for example, in our case, we are one of the countries
nuestras
pollute
economías dependen
the less.
mucho de los
Unfortunately,
combustibles
our
fósiles.
economies
Entonces,
depend on
sí se
fossil fuel
necesita ir
extraction.
haciendo transición.
So we
Y
do
yo creo
need
que
this
todas las
transition,
acciones
and
son
I think
absolutamente
that
importantes.
all
Cuando uno encuentra
actions matter.
contradictores en el tema, lo primero que dicen es que eso es responsabilidad de los
When
gobiernos.
you
Bueno, ¿y qué estamos
find
haciendo nosotros?
opposite
Nosotros necesitamos hacer
action,
abogacía
we
precisamente
always
porque es
make
que somos quienes nos
governments
estamos
responsible,
encontrando con los
but
pacientes, con
we
las personas, con las comunidades
professionals are the
afectadas
ones
por los
who
efectos del
are
cambio
in
climático en su
contact
salud.
with
Entonces nosotros sí
vulnerable
podemos
populations
alzar
and
la
people
voz y
affected,
es
so we
importante lo
can
que
raise our
estamos
voice and
haciendo
say
y
that what we're
utilizar
doing
estos
matters,
indicadores que
that it's
ustedes nos están
important, and
proporcionando
we need
justamente para
to
hacer
give
investigación, para
indicators,
poder
these
divulgar.
indicators
Hay
more
que alzar
visibility,
la
because
voz
it
y
will
hacer
make our
abogacía
job easier.
porque es la forma de
We
evidenciar
would
lo
be
que
able
está
to advocate
sucediendo, para que los gobiernos
about
sepan
what's
qué está
happening, so
pasando con las
actually
comunidades, qué
governments
está pasando
are
con la
aware of
salud de
what's
las
going on
personas
with
y no solamente de las
communities and the
personas,
health
de
of
todas
people,
las
and not only
seres
people,
vivos,
but all
trabajar el
living
concepto de One
things
Health.
to
Entonces,
work
es
on
poder
this
hacer
concept of
abogacía
One
y poder
Health.
alzar la voz. Creo que eso es absolutamente
I
importante
think
y
that's gonna
actuar
be
desde cada
crucial,
uno de
and
nuestros
act,
escenarios. No
each of
podemos
us,
dar la
from
espalda a
our
esta problemática.
sphere of
Gracias.
action.
Thank you so much, Dorian. I think calling it out and actually speaking out about the elephant in the room is a crucial first step. Thank you. Again, I would like just to thank our dear panelists for joining us. And just to remind everyone that we'll be sharing the recording of the webinar with all the participants afterwards. And for closing, I would like just to pass it to our dear CEO of Healthcare Without Harm, Miss Emily Bancroft, just to provide some closing remarks.
Thank you so much, Lujane, and thank you so much to all of the panelists, and also to the Lancet Commission team, our Lancet Countdown team, sorry. It was really wonderful. This data and having this information is so important. And so thank you for coming here today to bring this to us, and for our panelists for sort of bringing some color and some examples to what this really means in action. And I know that I personally leave this session much more convinced than ever that the evidence is clear, that the stakes are incredibly high, and that the health sector's voice, and specifically the voice of health professionals, and the action that you all can take is indispensable to addressing this crisis. And as you've all heard so clearly today, the Lancet Countdown reminds us that climate change is already a health emergency, and the impacts are showing up in the clinics in which you all work, in the hospitals in which you work, and in the communities in which we all live and work. We heard the evidence of rising heat-related illnesses, worsening air quality, vector-borne diseases, and the disproportionate burden on vulnerable populations around the world. And again, this aligns with, I think, what you all already experience daily, You may not need the report to tell you that climate is no longer a distant environmental issue, but it's actually reshaping the practice of medicine and healthcare today already. But the report is helpful because it provides some of that data and evidence that we can use to take action in our communities. And I loved hearing from the panelists on some of the concrete solutions where the health sector is already taking this action, measuring and mitigating its own climate footprint, building systems to adapt care to a changing environment, and as Dr. Ghosh said so eloquently, starting small sometimes in order to build that larger scale change that needs to happen. And this is not just about reducing emissions, it's also about improving health outcomes now and protecting future generations. And so I think the unifying theme that came out so clearly in this discussion today is that as members of the health sector, we have both unique credibility and also responsibility to continue to raise our voices about the crisis and about what can be done to address it. And as clinicians, as so many of you are on this call, you're trusted, you're science-driven messengers who can translate climate data into those human stories and action that really will drive people to make change. As Healthcare Without Harm, we are just so glad that you joined us today, because part of what we want to do is be able to support your voice and your advocacy around climate and health issues. In this last year, the Healthcare Without Harm Global Network, of which many of you are members, launched a new strategy, which was developed in collaboration with our partners in the United States, Europe, India, Southeast Asia, South Africa, across Latin America, and Australia and Oceania. And this strategy is grounded in accelerating the transition to climate smart, equitable, and resilient health systems around the world. And it has 3 core areas of work: helping the health sector directly mitigate its own climate impact, also supporting the health sector to build climate resilience in the care that you deliver every day and in the way that your facilities and your infrastructure is prepared to manage climate risk. And lastly, reducing unnecessary plastics in healthcare. This is a toxin that we know is impacting human health. It's a driver of fossil fuel expansion, and it's also something that is heavily used in the healthcare sector and contributes to the healthcare sector's climate impact. And so through this 3-pronged strategy, we're strengthening global networks, we're elevating local leadership, like all of you on this call today, and trying to help all of our partners move from commitments to healthcare climate action into some of that implementation that you heard from the panelists today. And across all of these priorities, health professionals and the health professional network that Lujane helps to curate and to work with so many of you across the globe and that our partners work with, that's a cross-cutting engine for impact across this whole strategy. It's how we can elevate clinician voices, mobilize frontline leadership, and ensure that patient-centered perspectives are really shaping policy and action. Because we know that health professionals consistently rank among the most trusted messengers in society. When you speak about climate as a health issue, people will listen. Just as an example, and one that touches on the fossil fuels question that just came up, 2 years ago, around the time of COP28, health professional networks created a global call by health professionals for a just transition and fossil fuel phase out. More than 46 million health professionals came together to sign this, to put together this global call, to sign it, and to take joint action. And what we found is that by having that health professional voice, the media listened, the WHO listened, and those outside the health sector listened. We saw the WHO Director General speaking at COP28 on the need for fossil fuel phase out, knowing that the WHO had the support of that health professional network. We saw 100 cities, more than 200 businesses, and 670 scientists also signed on to this call for action, again, leading the charge that you all started and you all led. And so these efforts really do make a difference in highlighting the health impacts of what fossil fuels was doing to communities, patients, and our planet. And it's these types of actions that really can make a huge difference in policy, both locally and regionally and globally. And so that's why we view these health professional networks as such strategic accelerators, driving awareness, accountability, and change, not just in the exam rooms where you all work every day, but also in boardrooms and in these global treaties and in these global commitments. And so the power of what we need to do moving forward lies in partnership across specialties, across disciplines, institutions, and associations. So glad to have pharmacy represented today. We need to widen the tent and really think about how the health sector can come together to address these issues. And so we at Healthcare Without Harm are committed to collaboration with professional associations, medical societies, and all the allied networks that want to help amplify the collective voice of health professionals worldwide. So thank you again to all of our panelists for their insights and for really showing us the urgency and for helping us translate this incredible document and this incredible body of research that's represented by the Lancet Countdown findings into something actionable that hopefully you all can start using in your work today. So thank you to our panelists, thank you to the Lancet Countdown team, and thank you to all of you who took your time today to be here in this call and to think about how you can bring this into your work, your leadership, your willingness to use your voice, your expertise, your compassion, your work with your patients every day. This is what turns data into change. So we look forward to working alongside you as we build a healthier, more just, and more resilient future for healthy people and a healthy planet. Thank you.